He is on the line with me. Dr. Djager, thank you so much for the time and thanks for holding on.
Thank you so much for inviting me to the platform. It's really a privilege to speak to you and your viewers.
Absolutely. Dr. Jager, SAAI has put out a warning that South Africa faces an economic disaster based on what we're seeing with the outbreak. So what exactly are you seeing at this time?
This is a very contagious disease. It spreads like wildfire. No farmer is safe. There are 2 provinces where we do not really have a crisis yet. But in the rest of the country, every day we pick up new cases on farms, whether it is smallholder farmers, communal farmers, peri-urban farmers, up to the mega-scale farmers, and the dairies are particularly vulnerable. We've seen devastation in the dairy industry. At this stage, we do not count progress or regress in days. We count it literally in the number of outbreaks and the number of farms who are going under. When you see this disease on your farm, you must by law immediately report it. But the problem is when you report it, they put you in quarantine for 12 to 14 months. It means for 12 to 14 months, you're out of business, no income. You still have all the expenses, but you have none of the income.
Okay.
And there's no plan to assist farmers who are in that predicament.
Okay, so perhaps let's look at just immediate risks then, following what you mentioned around the quarantine and all of that. Some of the biggest risks that you're seeing around the outbreak, and what do you think it is that it is spreading so rapidly?
Well, this is the nature of the disease. It spreads rapidly. It spreads through the movement of animals mostly, but it can also spread through water or in fog. We've always had foot and mouth. We've had an endemic zone. The whole of the Kruger National Park is endemic, or the virus is endemic to the park. Also, all along the borders of Mozambique and Zimbabwe, we take it for granted that it will always be there. But we managed it in zones, in a corridor that stretched between 15 and 50 kilometers, all along that zone. We had an observation zone in former times. And whenever we had an outbreak, we simply blocked off that observation zone. And then the rest of the country remained free from foot and mouth. And we could guarantee that. Hence, we could export red meat all over the world.
Yeah.
This is also the way it is managed by Botswana and Namibia. And they have access to the European markets. But for many years now, we have not guarded those zones so well. So we saw a number of outbreaks coming from that zone. First to the Free State, then to the Eastern Cape, then to Northwest Province, KZN, and it spread like wildfire. At this stage, it is completely out of control, and every day we see farmers going under because of it.
This is an absolute disaster, and I don't know at this point. I mean, I mentioned Minister Johan Steenhuisen. He has mentioned in several statements and interviews that they are working on a vaccination drive. But I know that SAAI and other organizations in South Africa don't believe that is enough. Declaring it an outbreak is not enough. So when we look at just, the biometrics of prevention of this disease, have we been doing enough? What needs to change so that we don't see this spreading further and continuing in this manner?
The minister did 2 very wise and brave things. Already in April last year, he appointed the best scientists we have, the best animal health professionals we have, onto a committee to advise him. And the problem was that the advice was not taken. Come December, these scientists and veterinarians said in public not one of their recommendations had been followed by the department. The next thing, the minister announced in the last week of November that we will do blanket vaccination of all our cattle. 14 million cattle from Cape Town to Messina and from Durban to Port Nolloth will be vaccinated. And this is how we will clear up the disease. Now, it's been done before. The Brazilians have done it. The Argentinians have done it with many more. You know, Brazil has close to 300 million cattle. So this raised a lot of expectations and hope amongst farmers. But it was 2 months ago, and until this day, no progress. The minister committed that he will do this in public-private partnerships, given the lack of capacity in the state. Remember, this is a state-controlled disease.
Yeah.
Me as a farmer, I'm not allowed to buy this vaccine, to import it, or to distribute it, or even to vaccinate my own animals. The state must do it by law. But in a public-private partnership, we can open up the capacity of private sector. Every veterinarian in every small town can become part of a network to combat the disease. But it's not being done. The applications, for example, to import by private agents for the foreign manufacturers, it takes weeks. We know of an application that went in more than a week ago, and the expectation in the industry was, because this is such an emergency, this import license will be granted already on Monday. Well, tomorrow is Monday again, and there was not even a progress report. So we hear the minister in stereo. We hear what he say, that how serious he is, but then we also hear that there is no progress on it. Hence, the farmers are not only impatient, they are really in a desperate position. They are going bankrupt, and that's why they are turning on the pressure on the department and on the minister to say, privatize as many of these functions as you can. Let's get it out of the hands of the state and let private sector drive this this really grand program of government. Government can still do all the measurements, do all the record keeping, but let's not wait for government to have enough vehicles, enough manpower, and to get onto each and every farm in the country. It's not going to happen the way we are planning it if we have only the government to depend on.
100%, and the farmers know best. At the end of the day, they've been doing this work for generations, you know. So as to how to really protect the sector and protect the animals and the industry at large, really needs to be up to them. It's just so unfortunate we have run out of time. Dr. Djager, thank you for your commentary. It is well noted, and I guess let's catch up again and let's talk some more on just response and perhaps how we can protect the sector going forward. Thank you very much for the time.
It's always a pleasure. Goodbye.